High blood pressure and diabetes are closely related together. There are about 60% of diabetic patients having hypertension complications. Both these diseases progress without specific symptoms and cause a variety of complications. People with diabetes tend to be prone to pressure of blood goes up, so it can be said that hypertension is also a worrying problem in diabetes. Therefore, the treatment and control of diabetes as well as the prevention of hypertension which are very important. It helps prevent many other diseases, especially cardiovascular disease. Hypertension in people with diabetes is 2 times higher than normal people according to studies. Hypertension is a factor that aggravates diabetes, whereas diabetes also raises pressure of blood and becomes more difficult to treat. Therein, it is found that the rate of hypertension in people with diabetes is 2 times higher than in people without diabetes. In patients with type 1 diabetes, hypertension is often the result of kidney complications. In patients with type 2 diabetes, hypertension can appear before diabetes. People with diabetes tend to be prone to hypertension. It has been shown that about 40 to 60% of diabetics who have high blood pressure. In addition, there are many cases where the blood pressure starts to rise frequently from a young age, and there are many patients with a long illness, so the frequency of complications is higher. Experts also pointed out that diabetic patients with high pressure, which does not only make the disease worse, but also increase the rate of coronary artery disease and stroke about 2 to 3 times higher than those without diabetes. In particular, hypertension and diabetes are risk factors for vascular disease such as coronary artery disease, stroke, limb embolism, retinopathy, kidney disease, neuropathy. The most commonly associated risk factors for vascular disease are age, stress, being overweight or obese, a diet high in fat, high in salt, sugar, inactivity, elevated blood cholesterol, and smoking, tobacco. Therefore, lowering blood pressure in diabetic patients is very important. Relationship between diabetes and high blood pressure. Diabetes and hypertension often happen together. People with type 1 diabetes account for 20% of the risk of hypertension, while people with type 2 diabetes are 80%. Because these two diseases are similar in mechanism of disease formation. The causes of these two diseases come together: obesity, inflammation, stress, and insulin resistance. Can hypertension cause diabetes? High pressure is the main cause of slow blood flow to the kidneys, making the complications of diabetes worse. Besides, some drugs that help treat them such as diuretics have the side effect of increasing blood glucose levels in the body. Can diabetes cause hypertension? The patient does not have enough insulin, and the insulin in the body does not work well to convert glucose from food into energy. Therefore, glucose cannot enter cells for energy, but instead accumulates in the bloodstream, causing blood sugar to rise. This makes the blood vessels more susceptible to damage, causing atherosclerosis. Over time, the patient's blood pressure will increase. What is blood pressure? What is high blood pressure? Blood pressure is the pressure exerted inside blood vessels as the blood circulates. There are 2 direct reasons for hypertension. One is that the blood vessels become hard and hard to expand, the second is too much blood circulating in the body. The reason that high blood pressure becomes a problem in diabetes is again, according to cardiologists, the main cause of hypertension in patients with diabetes is high blood sugar, increased blood viscosity, plus when the blood vessel walls shrink to form atheroma blocks the blood flow. For diabetics with hypertension, atherosclerosis is also more likely. This is a scary disease causing angina, heart attack, stroke. The first reason, many people with hypertension have diabetes. About 40 to 60% of diabetic patients having pressure of blood is high, which is twice as high as those without diabetes. In addition, since there are many cases of patients whose blood pressure begins to rise frequently from a young age, and there are many patients with a long illness, the frequency of complications is higher. The following factors make people with diabetes more susceptible to hypertension. The second reason makes atherosclerosis more likely. Atherosclerosis is a hard, inelastic phenomenon of arteries and a narrowed inner diameter of the blood vessel. This is a scary disease causing angina, heart attack, stroke. causes of atherosclerosis such as hypertension, diabetes, dyslipidemia, hyperlipidemia, obesity. These 4 causes adversely affect each other, and accelerate atherosclerosis progression, causing a very terrible vicious cycle called the metabolic syndrome. Specifically, when considering the number indicating the risk of diabetes and high pressure of blood for cardiovascular disease and cerebrovascular disease, if the risk level for healthy people is 1, the number is 2 to 3 times higher for people with diabetes, 2 to 3 times higher for people with hypertension, and 6 to 7 times higher for people with diabetes and hypertension. The third reason, accelerating the progression of diabetes complications, which also speeds up the onset and progression of diabetic nephropathy complications. The kidneys are a filter organ that makes urine and large amounts of blood continuously flow through the kidneys. Therefore, when blood pressure is high, a lot of burden is placed on the kidneys. Once kidney disease has started, blood pressure will increase with the progression of kidney disease, which further deteriorates the kidney disease. In addition, hypertension also has a negative effect on the blood vessels in the retina and accelerates the progression of diabetic retinopathy. People with diabetes need aggressive treatment even with mild increases in blood pressure. The patient's ability to control blood pressure along with good blood sugar level, and how long to live healthy will greatly affect the patient's life.